Hello, my family, my friends, my fans, and my followers. I am Andrew Ditch, and I am diagnosed with autism and intellectual disability. Today's video is about autism and intellectual disability is not a choice. It's not mental illness or learned behavior. This is why I do not have cognitive decline. This is part 2 of a multi-part video. Places I lived 1985 to 1988 parents' house in an apartment 1988 to 1992 parents' house on Morgan Street WNYCPC 1993 parents' house WNYCPC parents' house WNYCPC 1994 WNYCPC parents' house Connors Children's Center 1998 Connors Children's Center Parents' House 1999 Parents' House Bryline JD Parents' House 2000 to 2002 Parents' House WNYCPC Parents' House 2005 to 2006 Apartment of my own. I had so much help, but my parents had me stay at their house 90% the time because I couldn't be safe or take care of myself. 2006 to 2018 Parents' House Jail * 2019 Jail Parents' House Jail Hotel 1 Ecc Hotel 1 Sisters Hotel 1 Buffalo General Sisters Hotel 2 Niagara Falls Hospital Hotel 3 KMH Hotel 3 Ecc Home Jail Hotel 4 Parents' House Community Missions. While Hotel 1 had 5 different rooms I slept in after multiple hospitals and/or visits. 2019 80 plus, mostly med, all but one hospital admit for social admit for placement. 1 mental per APS request tonight. Falls 3 days. 2020 community missions 7 or visits Ecc home 1 night in jail 15 days on streets with 30 different or visits Hotel 1 for less than 2 months and multiple or visits Hotel 2 KMH for days on streets with 1 night at KMH ECC COVID shelter Hotel 3 for less than 2 weeks Hotel 3 1 hour Hotel 4 since end of May. See my behaviors here now compared to not knowing where I will live next. Millard Fillmore Hospital waiting for placement that has been denied again. 2021 Millard Fillmore Hospital Sisters Hospital Hotel in Niagara Falls for 5 days budget in Grand Island Parents' House Erie, Pennsylvania 1 night Parents' House Strong Memorial Hospital 2022 Strong Memorial Hospital Parents' House Pittsburgh in and out of hospital and Hilltop in Dad paid for Parents' House 3 different hospitals in Syracuse Parents' House June to February 23, 2023. 2023. Parents' House in and out of the hospital by APS. 2024. Parents' House April Buffalo General Hospital Sisters Hospital after DSS denial emergency shelter Newfane Rehabilitation Niagara Falls Memorial Medical Center 2 times Strong Memorial Hospital Rochester Regional Hospital MHA Strong Memorial Hospital 2 more times MHA Dad's House Sister Hospital from June to July Cleveland Hospitals Jail in Cleveland Erie, Pennsylvania Hospital and Shelter in August and July ECM Shelter Stranger Danger ECM Shelter Hospital for Stomach Bug and Hygiene Hotel Holmes Saint Group Home. How can anyone accuse me of learning to be autistic and intellectual disabled when this is all on my child records when no one reported anything like faking or learned behaviors? How can I have a sexual fetish when at 17 I was not even knowing what a personal relationship was and had no sexual identity and still do not to this very day? How can it be a sexual fetish to be incontinent and prescribed desmopressin acetate, is a synthetic hormone used to treat conditions like bedwetting, diabetes insipidus, excessive thirst/urination, and certain bleeding disorders, mild hemophilia A, von Willebrand disease, by regulating water balance and improving clotting factors. It works by helping the kidneys retain water and releasing clotting factors. Factor 8, von Willebrand factor, reducing urine output and improving blood clotting, but requires careful fluid management to prevent low sodium levels, hyponatremia. How can I get off on needing someone to help me wipe my butt properly with a facial smearing and undergarment? How can I be wanting to be touched when I had body odor and rashes due to not able to shower properly? These are possible causes for my autism and intellectual disability. My DNA results from 23andMe showed I have a SHANK3 is a 22q13 deletion syndrome, as shown on 2 DNA reports of mine linked to the pituitary and endocrine issue, ASD, diabetes, and other medical issues I am diagnosed with. On that report talks about the conditions I have could all be related. On that report from my DNA, it talked about other DNA linked to autism and pituitary and endocrine issues that are on my report. On my DNA report, it talked about my FOX2 gene had mutation that could cause me language processing issues and severe language issues. On this report, it talks about FOX2 as being part of causing autism. Mom got sick with influenza, and she reported in past, as I remember hearing this, she had diabetes issues when I was in her. She also reported she had multiple stomach issues. I was born 2 weeks early, with a ruptured placenta. I was born 2 weeks early. My childhood records talk about weight 5 pounds, APGAR of 2 and 7, and fetal distress and need suction and oxygen. My developmental history supports this diagnosis, my doctors have said. I remember Mom saying that I had difficulty with latching in her breast and feeding. She said doctors said I was a lazy sucker. She also said I didn't respond to noise normally and got upset with noise. I had hard time tracking and moving my eyes. I had a hard time responding to name. Dad said I appear deaf, as I do still today. Mom said I didn't talk 1 word to 5. Mom said I didn't sit up to almost 2. I did not crawl or walk. I start to run and jump at 2.5. I remember Mom saying. She said skip walk and crawl went right to jumping and running. I remember Mom say that games like peekaboo and wheels on the bus and different games with social interactions I got upset with and prefer to be alone. I remember Mom saying how I got info everything and took out light bulbs and HWL she has to have the Christmas lights high, so I didn't get hurt. I remember master the record player before I walk. I would play the record Ohio Express Beg Barrow and Steel Emblem all the time over and over again. I would be interested in electricity and outlets. I would escape and interest in water. I would take apart the crib and throw my toys on the roof and go get them. Mom had to use leash as I run away in stores to go in clothes, so it's what I think was darker than get lost and lost my parents who was searching for me. Mom said the one time I couldn't speak my name and Mom and Dad panic in a mall. I remember some of this stuff. I have good long-term memory, just not able to use the information to be independent. I had trouble with motor skills. I didn't use the bathroom, but was always interested in toilet flushing and had to see every toilet as I remember out of the house, but just couldn't use it as I don't feel the urge to go. It scares me because I need this help. My urologists say my urine diary is no pattern just like as a teen and kid still at 38, and I need to focus on life and use diapers with help of others. I have life skills and social skills to focus on. I've been told by speech therapy I may not learn new skills, but I need long-term speech and occupational therapy to maintain skills and behaviors issues. Early years in summary. June 7, 1985, I was born prematurely with a very low blood oxygen level in my brain on June 7, 1985, by emergency C-section after birth complications. June 1988, a normal baby would have 10 words that are understood by strangers. 1988 to 1990, I was in a school for developmentally disabled children, not for early intervention. Adding to the autism claim. I was in Summit because of speech and language delays and learning disabilities. 1989, after saying speaking my first word, gook, that isn't at all a word, but also meant everything I was for at this time. I was starting to learn to talk because of the Summit. 1992, 1993, 1994, I had 2 more school changes. I started to talk a lot more. I also was seen by what I remember mainly by Mom's stories over the years, every different mental health clinic and different tests and doctors who said all these different things. Every test showed abuse they claimed, because I repeated things that other people said because I got confused. And the mental health clinics felt different things on my diagnosis that caused my behaviors. After reading my CPC records and what I remember back then, how Mom and Dad fought a lot. It was a difficult time for me. But I was never neglected or abused by my parents. I remember how Mom read stories to us kids, and it was always one book I had to have Mom read. I remember then Mom having to read that book and a book that Joe wanted. Mom was given all these different things about me and what to do with me. I remember before going to Corners, I was in diapers, almost able to shower myself, had trouble wiping when I was on routine, and had trouble brushing my teeth. I also remember Bob Taylor telling Mom not to put me in diapers. He was doing it to get his way. I remember seeing different doctors as a child who said I needed diapers. Bob Taylor was only a home mental health provider added to my mental health care I had from different agencies. I remember by Mom's story that makes sense. After my second stay in CPC, Mom and Dad had completed family training for kids. Part of their training was where they had to help communicate the way I do and the behavior program and things that I felt were starting to work. But Mom said how Bob told her I didn't need that low level of care. After reading my CPC records to show that my parents are accused of not following through on treatment plans, how is this their fault when they were told so many different things? 1994 to 1998. Connors took me out of diapers. I remember sitting on the couch in front of my peers naked, a lot on plastic seat covers for the chair I sat at the TV and rec rooms. Also, was prevented from going to most activities outside Connors because of my soiling issues. I remember what Mom and Dad were helping me with showers. Connors didn't work with me on this. I was the only kid who was allowed to bubble bath at night and shower in morning. I had no help really with wiping or cleaning after I pooped myself. They had me shower. They also had other children use this red pill after brushing teeth. I was only given mouthwash and my toothbrush and paste to try on my own, but I had so many problems. They never had me use the red pill dye. Children's hospital dentist had to see me monthly for special cleanings and clear coats. It was where I felt I didn't learn to shower properly. I ask, please don't have anyone work with me on this. This is embarrassing, especially when I need diapers, and how APS is with me on this in hospitals. Having someone help me with showers will be too much for me when Mom almost had me independent on this. 1992, current. I seen Dr. Lichter for over a few months until Dad's insurance gave him trouble for not allowing me to see him as a kid. Then that same insurance, but a different job later when older, had denied me seeing Dr. Lichter. Like they didn't want to pay for some of my mental health care or medications. 1999 to 2005, school had me walk the halls every 30 minutes per drive. Lichter's orders. I used this to go to the bathroom to try. I was in the plastic diapers I hate, but then Mom learned about good nights, and then after got too big for these went to depend pull-ups. But Tranquility all through the night was my primary diaper. I had learned not to drink anything except after gym class, and my milk at lunch. I had most of my liquids after school and before dinner. This prevented me from getting wet in school, where I went weeks without a diaper issue, except for the poop thing. Poop was predictable for my voiding diary, so it was the toileting routine I had that prevented this, especially after my 2 tailbone cyst removal surgeries I had when school was afraid to change me if I had poop issue with the location of the surgery, and the nurse not knowing what to do. I had this packing I had in my wound to make it heal inside out with a big pad over it. Ouch, this hurt a lot. The tape is coming off, and the packing is coming out. I do have to say this was like what I have in my groin and armpit. If the surgery I had as a teen didn't hurt me only at unpacking and packing, I think it would help my current problems. 2000 to 2011, I have to say I had my mom's help with toileting routine where I didn't need diapers as much, but going to work and at night. I had to use diapers, but I got by with depend on pull-ups during the daytime, just in case. But didn't really need them, but still had to change my pull-up like 2 to 3 times a day. 2003 to 2012, when working I had a lot of help to get to work. I had a lot of help at McDonald's by everyone. I had lost this help at other jobs. I think McDonald's was different because of my last teacher I had was the reason I got the job and had the manager's support. I wasn't going to be hired if it wasn't for my teacher. I had learned to mostly be independent after I pooped myself and totally independent at putting on my diaper myself because of the managers at McDonald's. I still have difficulties in whipping myself even after I do make it to the toilet to poop. I use an entire roll of toilet paper. But wipes do make it easier for me. If I poop myself, I do need to shower to clean myself. But I gotten better at doing it without a shower as of late. Both McDonald's, Wendy's, Tops, and Walmart had me on similar potty routine. Schools. 1988 to 1992 Language Development Program. Not early intervention, as some have the dates but no actual records. June 1993 WNYCPC report stated my mom and dad reported to WNYCPC that I did very well at school due to the supports I had for long and social skills. The school specializes in autism. CPC reported my parents said the behavior started in first grade. In first grade, I was in public school and lost the supports for my autism and disabilities. Home is a safe place, so the behaviors occurred for this reason. Mom back injury had to care for me and my needs with structure and social and behavior issues. My brother Joe has severe asthma and Asperger's and TBI at the time almost died from his asthma. Mom had to care for Joe or he die and leave me without the care I needed. Dad worked 3 jobs to feed and clothe and care for us so Mom can heal with her back and care for me and Joe. This is why I had the behavior issues. Due to need diapers and the delays and behaviors, it was then questioned of sexual abuse that I started to repeat to others. This caused doctors to think I was crazy and gave different reports and changed things. I draw pictures to maybe help me process what is said and happening like I do now, maybe I don't know. I talk things out like this to help me understand things as an adult, so maybe I did the same thing to help me make sense to it. This was used to say I was abused. Then in 2001 CPC took away the PTSD and say it is personality disorder, as I call out rule breakers and tattled on others like I do now. This is used to say I argue authority. Each time I lost supports I need structure, prompts, redirection, help to understand things and to cope and use skills and to interact with others. I had the behavior and emotional issues. I didn't need meds at age 8. I don't need them to help me sleep or not have anxiety or depression as an adult, as when Dad is helping me, I don't have these issues. Proof, not mental illness. I know this from my many mental health doctors and therapists who evaluate me for this. 1992 Fletcher Elementary, 1st grade. 1993 Bosse's, 2nd grade. 1993 to 1997 Stanley Falk Cheektowaga. 1997 to 1998 Stanley Falk Delaware. 1998 to 2005 Stanley Falk Cambridge. I am 37 years old, no hallucinations and no delusions still, and never remember having one of these issues. Not on mental health meds since 2018. Was not on mental health meds in 1993, and I improved with a miracle recovery, as reported on my hospital record with only structure and support, and not on any mental health medications. Difficulty in organizing and interpreting social and environmental cues. IQ decline question. I feel my IQ drop was from not having the supports in school to improve my reading and language skills and attention, and because of not having home supports made behaviors in school a problem to add to attendance issues. My understanding as you age, your academic knowledge and communication and language skills should improve. Mine did not. Also, my higher IQ in 1993 doctors have told me that it is common with autism people to experience unstable and higher IQ score early childhood, and then it becomes more stable and consistent later in life. These IQ scores also dip slightly lower when this levels off. Plus, the test of 106 full-scale IQ in 1993 was likely modified for less verbal skills because of my communication disability. DX in history from 1990 to 2018. No DX of dementia or TBI. No confirmed, no findings of schizoaffective disorder or schizophrenia or bipolar disorder. Diagnosis confirmed. Speech and language disorders as DX since birth. Reading disability. Autism spectrum disorder. Central auditory processing disorder. ADHD. Learning disabilities. Tourette's. IQ tests. 1990 age 6 score 86, WNYCPC records. 1993 age 8 score 106, WNYCPC records. 1997 score 91, school records. 1999 score 89, school records. 2002 age 16 score 86, school records. 2004 age 19 score 89, school records. 2018 age 33 score 87, Dr. Santa Maria. Academic grade level. Reading. 1993 age 8 grade 1.3. 2002 age 16 grade 4.6 age equivalent 10.0, school records. 2003 age 17 grade 5.6 age equivalent 11.0 school records. 2004 age 18 grade 7.3 age equivalent 12.8 school records. 2005 age 19 grade 6.6 age equivalent 12.1 school records.
Math.
2002 age 16 grade 5.9 age equivalent 11.6 school records. 2003 age 17 grade 6.6 age equivalent 12.1 school records. 2004 age 18 grade 8.0 age equivalent 13.4 school records. 2005 age 19 grade 8.9 age equivalent 14.3 school records. Writing. 2002 age 16 grade 4.5 age equivalent 9.8 school records. 2003 age 17 grade 4.9 age equivalent 10.1 school records. 2004 age 18 grade 5.7 age equivalent 10.0 school records. 2005 age 19 grade 5.4 age equivalent 10.9 school records. DSM. I have to say, these are the symptoms of my struggles I have in life with autism spectrum disorder, ADHD, and what I don't understand, why I have intellectual developmental disability, and have a few questions on this diagnosis. Then I have a few diagnoses I feel are wrong, and other diagnoses that no doctor agrees with. I also feel I have adjustment disorder and panic disorder, but when asked about these diagnoses, they say my panic is from my autism related and fear of losing control with the meltdowns from my autism. The doctors in past said because the criteria says if from another condition, it cannot be diagnosed. One more condition I think I might have and been said no as well, that general anxiety disorder, and doctors keep saying that my anxiety is from my autism and unmet needs because I am unable to take care of myself. The doctors also had past diagnosis of major depression disorder unspecified. However, the doctor who said this said, I do not meet the criteria for this diagnosis because of my not having depression for longer than situational triggers and does not impact my function, and also is very mild when it happens. They feel my depression is mimicked by autism burnout from my masking and being forced to do things I am not able to do or handle. Autism spectrum disorder. Diagnostic criteria F84.0. Persistent deficits in social communication and social interaction across multiple contexts, as manifested by all of the following, currently or by history. Examples are illustrative, not exhaustive. See text. Deficits in social-emotional reciprocity, ranging, for example, from abnormal social approach and failure of normal back-and-forth conversation, to reduced sharing of interests, emotions, or affect, to failure to initiate or respond to social interactions. I have a misdiagnosis of schizoaffective disorder without depression or bipolar symptoms. Knowing this shares symptoms with schizophrenia, it is exactly why I have ASD. I didn't talk until age 5. I had issues with this symptom all of my life dated in preschool and to this day. I can't show interest in others as I don't know how to. It causes me isolation and loneliness, and it makes me sad. Deficits in nonverbal communicative behaviors used for social interaction, ranging, for example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures, to a total lack of facial expressions and nonverbal communication. I have trouble with social and environmental cues. I don't use gestures to express myself as a normal person. I had a hard time knowing how to wave to someone like my grandma, as I remember I waved with my hand the other way than normal. I didn't know how to point. I learned to point and wave in LDP. When it is not safe to cross the street, hold hand in front of me to show me to stop is something I had to learn. I have a hard time expressing my true tone of voice when I am sad or scared. It comes as anger. I have a hard time expressing myself through face expressions. I don't understand the emotions and body language of others. Deficits in developing, maintaining, and understanding relationships, ranging, for example, from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or in making friends, to absence of interest in peers. I have a hard time stay on topic. I have a hard time making friends and keeping friends. I don't know how to keep a conversation going. I have one-sided conversations about my topics. I don't know how to talk about others' point of views. This makes me scared to talk to people, and I just don't know how to. I talk to my counselor as I talk to my friend and my family. I act the same way I do in school and home and play as I did at funerals and things. Restricted, repetitive patterns of behavior, interests, or activities as manifested by at least two of the following, currently or by history. Examples are illustrative, not exhaustive. See text. Stereotyped or repetitive motor movements, use of objects, or speech, e.g., simple motor stereotypies, lining up toys or flipping objects, echolalia, idiosyncratic phrases. Yes, and this causes me issues with social interactions. It makes shower and sports hard. It makes writing hard. It makes taking my pills hard as I need them in order. I find it help to flip things and push buttons and move things. I love to repeat things. I love to rock and move. I can't rock when my back hurts me from doing it. I can't snap my finger when my wrist hurts me. I hit my head a lot. I repeat the things said my dad gets mad at me for making him. People stare at me. They ignore me and it makes people scared. I have tics and stims all my life. Having tics and stims like arm flap and jerks makes people scared. They don't understand why I do it. They think I jerk off or sexual when I am not. I'm in diapers. They don't like that. I need help with diapers. It is not something people want to do. Insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behavior, e.g., extreme distress at small changes, difficulties with transitions, rigid thinking patterns, greeting rituals, need to take same route or eat same food every day. I need routine. I need the same foods. I can't transition. Part of my biggest issue with going out of the house is I don't have help when to transition and break from a task. This causes me to poop my diaper a lot as I have some feeling of when I need to go, like when my stomach hurts or sick to my stomach. I don't know, I have to go. I think I can wait to finish a task and I have an accident as I waited too long and I can't wait to finish it after. I can't cope with change. I have panic. I can't understand when to expect things or what to expect. My dad makes it so unpredictable and he knows this and loves the behaviors it causes me, or I feel he wouldn't do this to me. When he helps me with what to expect and when and line up my day with his and my family's day, I don't have issues. Changes happen and he don't help me before the change or to explain the change to me in a way to help me understand and to accept it and to help me with doing something else. I am unable to regulate my emotions and be independent at doing things and decisions. Highly restricted, fixated interests that are abnormal in intensity or focus, e.g., strong attachment to or preoccupation with unusual objects, excessively circumscribed or perseverative interests. I carry my teddy bear, stress toys, I lost my fidget spinners, and I love to carry things. I carry my book bag, and in my diaper bag, I carry more fidget toys and things. The other day at the Dollar Tree, I had to be a retard by spin the truck wheel over and over. I didn't want to play with the truck, just the tire, like I did when younger. It was hard to use Legos like other kids did as I had to stack them by color and shape and size. My Lincoln Logs, I made the same shape house as someone showed me how. Hyper, or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment, e.g., apparent indifference to pain/temperature, adverse response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. Do no-brainer. Just read the chart in this information. C. Symptoms must be present in the early developmental period, but may not become fully manifest until social demands exceed limited capacities, or may be masked by learned strategies in later life. I didn't talk to 5. I had language issues, social skills issues, limited friends, hard time with understand things around me and what is said, did my best as a kid in highly structured and consistent environment, and had tics and stims, and weather was my topic, and these issues made it hard to learn, to use the toilet, shower, brush my teeth, work, respond to a fire alarm, and cook and cut food, and even eat. It is not something I want and not something I like. People make me feel so bad about having these issues all my life. I don't like it anymore. This world is not made for me. I can't take it anymore. I want help. I want to work and help people. I want to do things. The diagnosis is the group of my behavior and symptoms, and the age of onset is what makes this a valid diagnosis. The need for services for my autism is how it causes me difficulties in life, how it causes me anxiety and depression, and I can't work and have friends and take care of myself. It is why I don't agree with intellectual disability as my diagnosis. I think my head banging causes me the intellectual disability. I think my dad holds me back by refusing to help me with AAC and my life skills and routine that makes my ASD worse, and the emotional issues make my ASD worse because I am not getting the care I need. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. Social pragmatic communication disorder. These disturbances are not better explained by intellectual developmental disorder, intellectual disability, or global developmental delay. Intellectual developmental disorder and autism spectrum disorder frequently co-occur. To make comorbid diagnoses of autism spectrum disorder and intellectual developmental disorder, social communication should be below that expected for general developmental level. Note: individuals with a well-established DSM-4 diagnosis of autistic disorder, Asperger's disorder, or pervasive developmental disorder not otherwise specified should be given the diagnosis of autism spectrum disorder. Individuals who have marked deficits in social communication, but whose symptoms do not otherwise meet criteria for autism spectrum disorder, should be evaluated for social, pragmatic, communication disorder. I have these issues. If I don't have autism, I have this diagnosis. The difference is the criteria B of ASD I have, and that is another differential diagnosis. Intellectual developmental disorder, intellectual disability. Diagnostic criteria. Intellectual developmental disorder, intellectual disability, is a disorder with onset during the developmental period that includes both intellectual and adaptive functioning deficits in conceptual, social, and practical domains. The following three criteria must be met. Deficits in intellectual functions, such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience, confirmed by both clinical assessment and individualized, standardized intelligence testing. I have issues with planning, problem-solving, reasoning, judgment, abstract thinking, and learning disabilities, a handicap learner, and trouble with learning from experience. This is all by speech, inkblot, IQ, grade level tests since I was a kid. Deficits in adaptive functioning that result in failure to meet developmental and sociocultural standards for personal independence and social responsibility. Without ongoing support, the adaptive deficits limit functioning in one or more activities of daily life, such as communication, social participation, and independent living, across multiple environments, such as home, school, work, and community. If you look at my child records, and you can see I had issues with personal hygiene, dressing, communication, behavior, and emotional regulation, and I was never able to cook or care for myself. I may not have adaptive tests as a kid, but if you look on my records, you see I had the same deficits I have today at age 7 and 19. Onset of intellectual and adaptive deficits during the developmental period. Mild conceptual domain for preschool children. There may be no obvious conceptual differences. For school-age children and adults, there are difficulties in learning academic skills involving reading, writing, arithmetic, time, or money, with support needed in one or more areas to meet age-related expectations. In adults, abstract thinking, executive function, i.e., planning, strategizing, priority setting, and cognitive flexibility, and short-term memory, as well as functional use of academic skills, e.g., reading, money management, are impaired. There is a somewhat concrete approach to problems and solutions compared with age mates. Social domain compared with typically developing age mates, the individual is immature in social interactions. For example, there may be difficulty in accurately perceiving peers' social cues. Communication, conversation, and language are more concrete or immature than expected for age. There may be difficulties regulating emotion and behavior in age-appropriate fashion. These difficulties are noticed by peers in social situations. There is limited understanding of risk in social situations. Social judgment is immature for age, and the person is at risk of being manipulated by others' gullibility. Practical domain, the individual may function age-appropriately in personal care. Individuals need some support with complex daily living tasks in comparison to peers. In adulthood, support typically involves grocery shopping, transportation, home and childcare organizing, nutritious food preparation, and banking and money management. Recreational skills resemble those of age mates, although judgment related to well-being and organization around recreation requires support. In adulthood, competitive employment is often seen in jobs that do not emphasize conceptual skills. Individuals generally need support to make healthcare decisions and legal decisions, and to learn to perform a skilled vocation competently. Support is typically needed to raise a family. Moderate conceptual domain, all through development, the individual's conceptual skills lag markedly behind those of peers. For preschoolers, language and pre-academic skills develop slowly. For school-age children, progress in reading, writing, mathematics, and understanding of time and money occurs slowly across the school years and is markedly limited compared with that of peers. For adults, academic skill development is typically at an elementary level, and support is required for all use of academic skills in work and personal life. Ongoing assistance daily is needed to complete conceptual tasks of day-to-day life, and others may take over these responsibilities. Social domain, the individual shows marked differences from peers in social and communicative behavior across development. Spoken language is typically a primary tool for social communication, but is much less complex than that of peers. Capacity for relationships is evident in ties to family and friends, and the individual may have successful friendships across life and sometimes romantic relations in adulthood. However, individuals may not perceive or interpret social cues accurately. Social judgment and decision-making abilities are limited, and caretakers must assist the person with life decisions. Friendships with typically developing peers are often affected by communication or social limitations. Significant social and communicative support is needed in work settings for success. Practical domain, the individual can care for personal needs involving eating, dressing, elimination, and hygiene as an adult, although an extended period of teaching and time is needed for the individual to become independent in these areas, and reminders may be needed. Similarly, participation in all household tasks can be achieved by adulthood, although an extended period of teaching is needed, and ongoing support will typically occur for adult-level performance. Independent employment in jobs that require limited conceptual and communication skills can be achieved, but considerable support from coworkers, supervisors, and others is needed to manage social expectations, job complexities, and ancillary responsibilities such as scheduling, transportation, health benefits, and money management. A variety of recreational skills can be developed. These typically require additional support and learning opportunities over an extended period of time. Maladaptive behavior is present in a significant minority and causes social problems. On the severe domain, I had a lot of these in my early childhood and teenage years. Few of these examples I still have today, such as I have the time management and some money management issues. I have problem-solving issues. Communicating and processing issues are still a problem. I have a few of these issues like bathing, dressing, pee and poop, and cleaning and caring for myself. But I don't think it is as severe as it is in the way it is written here. I feel I am mild intellectual disability, and I am not getting the support I need by anyone, and I am held back from what I can do because of this. Severe conceptual domain attainment of conceptual skills is limited. The individual generally has little understanding of written language or of concepts involving numbers, quantity, time, and money. Caretakers provide extensive supports for problem solving throughout life. Social domain spoken language is quite limited in terms of vocabulary and grammar. Speech may be single words or phrases and may be supplemented through augmentative means. Speech and communication are focused on the here and now within everyday events. Language is used for social communication more than for explication. Individuals understand simple speech and gestural communication. Relationships with family members and familiar others are a source of pleasure and help. Practical domain, the individual requires support for all activities of daily living, including meals, dressing, bathing, and elimination. The individual always requires supervision. The individual cannot make responsible decisions regarding the well-being of self or others. In adulthood, participation in tasks at home, recreation, and work requires ongoing support and assistance. Skill acquisition in all domains involves long-term teaching and ongoing support. Maladaptive behavior, including self-injury, is present in a significant minority. I did not graduate from high school. I have a language level of a 12-year-old. I am reading my medical records and seeing these things went missed in childhood. I see what my doctors have diagnosed me with that many people are not wanting to accept. I did not learn to be disabled. I did not learn to be helpless. I have come a long ways in the last year with therapists and caregivers. I am not able to be independent. I am being forced to do things not safe and not capable of doing. However, I am able to do a lot of things myself with help of others. I am also able to repeat the things in my medical records. I can repeat things my doctors have told me and my past doctors told me. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. Do you want to see a video of me shopping with using my AAC device independently sometime? I will talk to you on my next video.